If you or someone you love are living with metastatic breast cancer, you're not alone. In the U.S., it's estimated more than 168,000 women are living with advanced breast cancer. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, during Breast Cancer Awareness Month, we're talking about St. Luke's Koontz Center for Advanced Breast Cancer, a one-of-a-kind treatment center designed specifically for these patients. With me today is Dr. Timothy Pluard, the Medical Director of St. Luke's Koontz Center for Advanced Breast Cancer and of St. Luke's Cancer Institute. Thank you so much for joining us.
Thank you for having me.
So, Dr. Pluard, first of all, this marks the 5th anniversary of the opening of St. Luke's Koontz Center. Can you talk about the need you saw years ago that led to its opening?
Well, at the time we went about planning for this, there was an increasing awareness of the complexity of metastatic breast cancer as a whole, but especially metastatic breast cancer, and quite a significant number of new therapeutic options available. And we looked at this and saw that there was a huge need to focus specifically on this population. And so we went forth and launched the Koontz Center.
That's great. So what makes the Koontz Center unique as it relates to a patient's treatment?
So I think one of the distinguishing characteristics is we focus only on metastatic breast cancer. So our team is doing that all day, every day. And so we've also assembled a integrative team to support the care of these women, because it's not just the treatment, it's the other aspects of their care to try and help them not only live longer, but live better. So we incorporate nutrition, exercise, psychosocial aspects of care, and social work, because this has significant implications both on them and their families and caregivers. So we try and have an entire team focused solely on these patients with metastatic breast cancer.
That's fantastic. Can you talk a little bit about the clinical trials available through the Koontz Center and the genomic testing as well?
So, one of the foundations of our center is really clinical research to try and advance the care and the outcomes of patients with metastatic breast cancer. And it also gives patients opportunities to avail themselves of treatments that might otherwise not be available to them, right? So one of the things we always talk about is in the course of this metastatic breast cancer journey that you try and utilize all the treatment cards in your hand. And so clinical trials just expand the number of cards that you have in your hand. So it gives you an option for a treatment that you might otherwise not have, but also it helps those other women in the future who may benefit from clinical trials that bring new drugs to the market.
Absolutely. So life expectancy has dramatically improved for advanced breast cancer over the past 20 years. What's led to that?
I think it's a combination of our greater understanding of the biology and our use of genomics to understand the specific mutations in an individual tumor that are driving its growth, and therefore that we can potentially target with new drugs. That, and I think the increase in technology. We have taken monoclonal antibodies, which are drugs that target specific proteins within the body, and identified unique targets on the cancer cells that these antibodies can identify. And then taking those antibodies, they've attached a chemotherapy payload to it. So essentially, you are delivering targeted chemotherapy to the cancer cells and sparing the normal cells in the body. So this has led to a significant improvement in the efficacy of the treatment, but also reduced the side effects of treatment and made it more tolerable.
That's fantastic. And you said you've seen improvements in just the past 2 to 3 years that you haven't seen.
Yes, we've been involved in clinical trials in the last 5 years that have led to 4 new drugs being approved for metastatic breast cancer, which is an incredible rate of new drugs that we previously did not have access to. And these drugs have been shown to improve survival as well as the quality of life of patients with metastatic breast cancer.
That's fantastic. So looking to the future, are there any exciting treatments or developments on the horizon?
Many. And probably, the most recent one has been the identification of the new population within metastatic breast cancer called HER2 low. We've always identified HER2 positive breast cancer and HER2 negative breast cancer. But there's a group of patients that has some HER2 expression, although they don't meet our classical definition for being HER2 positive. However, this population, which encompasses about 55% of all metastatic breast cancer patients, has now been shown to respond to some of these antibody drug conjugates, these monoclonal antibodies carrying this chemotherapy payload. And so that's been transformative for a huge number of patients with metastatic breast cancer.
Fantastic. How new is that?
That data was actually just presented in June of this year, and the drug was approved.
Wow.
For that indication.
Very exciting. Well, what's your final message for anyone watching with metastatic breast cancer?
I think there's incredible hope now that we are extending the lives of patients with metastatic breast cancer and improving the lives so that they can not only live longer, but live better.
Absolutely. Well, thank you so much for joining us.
Thank you.
To learn more or to schedule a consultation, visit stlukeskc.org/onlykoontz. That's stlukeskc.org/onlykoontz. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.